If you've ever struggled with an email, a text, or somebody telling you, why do I have to keep coming back? And you want to figure out how to avoid that question so you can help patients long-term, this video is perfect for you. My name is Garcia. I help cash-based PTs like yourself improve clinical outcomes and improve patient satisfaction in your business or in the business that you currently work in. When you talk about patient satisfaction, we talk about expectations, and we talk about patients who are happy. When a patient says, I thought we were done, or I don't understand why we have to come back, that patient had the expectation of a finite number of visits. And that's the problem that exists from the very beginning. When a patient says, I'm no longer in pain, why do I need to come back? It becomes that the cash-based PT, you or anybody you work with, set poor expectations that maybe the pain relief was the end of the destination. Now, if you're in cash PT, you know that pain relief is only phase 1A, and the next phase after that is how to get them away from pain so it doesn't come back and prevent future injury and getting them stronger. So if you understand that pain relief is here and your destination is over here, that customer came in and said, well, I thought we were done. Why do I need to continue? You set the guideline that this was the end point, and what you failed to do is tell them that this was portion of it. Now, and maybe you did, and that customer understands, well, I've achieved it in their head. That's why they were here, just to get the pain relief. What probably happened is you failed to remind them at every single point what the final destination was and build value on that. So if you have a patient who says, I don't understand why I have to keep coming, they no longer see value in your services, and that's a problem. And if you're a cash PT, it's the dreaded problem. It's the reason you got out of insurance-based care, because you wanted to provide a service that was bigger, better, and more valuable long-term for people. So if you have somebody telling you that, you basically applied an insurance-based model, which is, I'm going to see you twice a week for 6 weeks, and that's the end, right? Think about that. That's why insurance-based PT is the way it is. The insurance-based or the insurance or the primary care provider said, you get 12 visits, you're authorized for 12 visits. So at the end of 12 visits, you're done. When somebody in a cash PT setting says, I'm done, it means that their expectations were met for that phase, or they weren't met and they don't want to come back. In either case, it's not ideal. So if you're looking to be more successful in a cash PT setting, the only way you go around that, if it's already happened, it's too late. All you can do is help the next person in line. So the way you do that is you help people understand what you do, whether it's over the phone or in person, and let them know, I understand that pain relief is what you're looking for. What I don't want you to do is have to come back here. And if I let you go at that pain relief phase, I just know you'll be back in 6 months. So if you're looking for long-term relief, you have to go on to phase 2 and phase 3. And you can choose wherever you want inside that path. So for the first 6 weeks, it's going to be pain relief. And I know you're going to feel fantastic and you're going to be tempted to leave. But please, this is where most of my customers gain the best results. They stay for the next phase where they're no longer painful, but they build strength. They're more resilient. They don't have the challenges they need to. We're now working on their fitness routine and how to stay in the gym for longer and with, more strength and less aches and pains. Then the next phase after that is seeing me monthly or 6 weeks or every 8 weeks to understand for checkups, just like you do with your dentist. And you can now see that this is a 4 to 6 month plan. And that customer now sees, well, I probably don't want to come for that long, but now they have the expectation that pain relief is not the end and that they can continue to see. And if you don't help them understand that, you're going to get that dreaded text or email or in-person message, we're done. I'm out of pain. I don't understand it, why I need to see you. And if you do that, you know you're underserving them, because pain relief is just temporary. Pain starts because you have undue stress in a specific area. And just because you manually treat the area doesn't mean you've improved their mechanics, you haven't improved their programming so that they know how to reduce that across their lifespan, and that they build those motor control habits to be able to do that under load, under stress for a long period of time. And if you just do pain relief, you haven't built the foundation of neuromuscular control and muscular endurance and muscular strength. And those each take 4 to 6 weeks. So if somebody gets somebody out of pain in 6 visits, there's no way they built a solid foundation to help prevent that from the future. And that's why that patient won't say, well, I'm done. You said it was 6 visits. That was my fault. That was phase 1 and you're already out of it. And so if you're thinking about what do I do with the past patients, I think you just keep in contact with them and checking with them so that when they do get hurt, you're the number one person they think of. But if you're looking at preventing that, all you can do is help somebody see where they are along that path, where they can see themselves in the future, and they can pick where they want to be. And so if you're just relying on that first phase, you're going to see yourself with those constant emails. And I've faced this personally in the past, and the best thing to do is help people understand what you can do with them across a menu or a timeline, so they can see themselves in it. And that at that point creates more success for the patient, most importantly, and you as a business owner, to help people across their lifespan versus just regional pain. That is where Cash PT is going to thrive, and that's where you'll thrive inside your business. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.